So to warm up before the exercises, we're going to put the patient on the bike. They're going to bike for about 10 to 20 minutes, and they're going to go slow and then without resistance, and then eventually they're going to increase the resistance and speed. After the warm-up, the athlete's going to want to stretch out her calf using the slant board, bending her knee and keeping it straight to get both gastroc and soleus. Also stretching the hamstrings. If you don't feel the stretch with just the foot on the chair, you can lean forward, keeping your hips in a pelvic tilt. For stretching the quadriceps, the athlete can lay down on the ground and pull her foot back towards her butt, keeping her leg as close to the other leg as possible. The athlete's going to do standing hamstring curls. She's going to slowly bring her knee up, bending, flexing her knee, and then going back down. She's going to do 3 sets of 10 of these. And when she progresses, we can add more cuff weight. She's going to do knee extensions with cuff weight on her ankle. So she's going to want to contract her quad and extend her leg. While doing this, she's going to hold it up top for about 3 seconds and go back down. She's going to do this three times for 10 reps. Right now the athlete's going to perform TKEs. She's going to slowly bring her knee back against the resistance of the band, and right now she's on the easiest level, and you can progress to the harder colored bands. She's going to do about 20 of these. We're going to have the athlete do step ups, so she's going to step up with both feet and then go back down and go back up. And to progress, when these get too easy for her, you can do it at higher weight and higher height. She's going to step up and step back down, and eventually she can go faster. And she's going to do about 20 of these. Now the athlete's going to incorporate lateral movements too with the step up. So she's going to step up, then she's going to go down to the side, tapping both feet down, then going back up. She's going to add a little routine. Then increase to a higher height. Do the same thing. You can have it do different directions. To make it fun, she could either go along to a song if the physical therapist wants to play a song. The athlete's going to do a wall slide. So she's going to progress from a mini wall slide down to a full 90 degrees. She's going to stop right about there and come back up, making sure her toes are in line with her knees and her knees aren't going over. And then she's going to progress to a single leg squat. She's going to go down and come back up. She's going to do 3 sets of 10 for each one. To progress the athlete for weeks 6 to 12, the athlete's now going to go from a mini squat, which she was doing in weeks 0 to 4, now to a double leg squat to the seat. So she's going to have her legs apart, hands on hips, and squat down to the chair. Just tap and come back up. Make sure the feet are straight ahead and in line with the knees. And then to progress this, you're going to add a little pillow on the seat. And then you can do one-legged squat to the chair. And back up. Again, make sure the knee, toe, and hip are all in line. So the athlete's now going to perform monster walks. So she has a band around her ankles, a TheraBand with resistance. You can always increase that. And she's going to walk forward, making sure her knees and her ankles stay in line with her hips, not moving in. Now she's going to walk backwards. Again, making sure the knees do not Move in immediately. Making sure she has a bend in her knee, a good athletic position stance. And now she can go lateral. And back that way. She is now going to be performing lunges, so she's going to go lunge forward to stationary, drop her knee straight down, keeping her knee not from going over her toes. I'm just going to keep going down. And all she's doing is dropping her knee, keeping her core tight. And then you can progress to reverse lunges and forward lunging too. Again, just dropping your knee, keeping everything in line. Just going to do 3 sets of 10 of both legs in all directions. My athlete is going to be doing hamstring curls on an exercise wall. She's going to want to go up to a bridge. She's going to curl her legs in, keeping it nice and stable, core tight, and roll back out. Keeping a straight line from the bridge form and going in, getting those hips up, and rolling back out. She'll do 3 sets of 8 for these. Exercise, the athlete's going to go on a Bosu ball. She's going to do an air squat. And this is to increase her proprioception back. She's going to keep her balance, also squat down, keeping her toes and knees in line with her hips. And she's going to do 3 sets of 8 of these. We're going to work on the athlete's balance and proprioception again. So we're going to do med ball tosses on Eric's. And you want to do all different spaces. So she's trying to reach for it and keeping her balance. And you're going to do this 10 times. And then you can even move to a different direction. So she's catching it from the side. And you're going to do each direction 3 times.
So we're going to have the athlete progress for like some functional, to begin functional with some slide board activities. So she's going to put the little booties on, set the slide board to the proper height, which is usually the athlete's height. And she's going to push off with her left foot to begin, using her arms to propel her across, landing, push back off, and sliding back and forth. We'll have her do this for about 2 minutes and then rest, and then do another 2 minutes. We can have her increase the speed of it if she wants, or she could do it with the weighted vest if this becomes too easy. But to begin, this is what we're doing.
So further surgery, they put skull marks, so we're just going to try to massage out where the skull marks are to get rid of the scar tissue. So ticklish. Carefully rub it out.
Even for educational? Yeah. Well, the one I have, it